Good morning. My name is Dawn Plummer, and today I will be discussing Advanced Practice Registered Nurse Scope of Practice, focusing on how allowing APRNs to practice to the full extent of their education and training advances the healthcare delivery, particularly in our state, Kentucky, and the rural communities throughout. Good morning. Scope of practice law determines what APRNs are legally permitted to do. According to the National Academy of Medicine, formerly known as the Institute of Medicine, nurses should practice to the full extent of their education and training. They advocate for removing unnecessary regulatory barriers that restrict advanced practice nurses from functioning autonomously. However, Kentucky is classified as a reduced practice state, meaning that APRNs require collaborative agreements for prescriptive authority. These regulatory barriers impact access to care, particularly in the rural areas that were mentioned earlier. There have been several studies emphasizing that removing scope of practice barriers improves healthcare access and system efficiency. Research within the past 5 to 10 years demonstrates that nurse practitioners provide care comparable in quality and safety to the physicians found in the same area. Studies show expanded scope is associated with improved primary care access, particularly in underserved rural areas, while maintaining those high quality outcomes we expect. From an ethical perspective, justice requires equitable healthcare access. Restrictive scope laws may disproportionately affect rural communities in Kentucky. Beneficence requires that providers act in patients' best interests, and we see that today, that limiting qualified APRNs may delay that treatment. Non-malfeasance means avoiding harm. Lack of access due to regulatory barriers may contribute to worse outcomes. These ethical principles support modernizing scope of practice regulations for APRNs. To overcome scope of practice barriers that we see in Kentucky, legislative advocacy toward full practice authority is essential. APRNs can engage with policymakers, support evidence-based reforms that align with recommendations from the National Academy of Medicine. Active participation in professional organizations strengthens collective influence and provides a unified voice when addressing regulatory change. Public and legislative education is also critical. Many misconceptions persist regarding NP's training and their clinical outcomes. Sharing the data that supports the opposite, it demonstrates comparable safety and quality outcomes, can help reduce opposition and increase that support that we need. And lastly, supporting seamless academic progression, including doctoral preparation and ongoing competency validation that we see with registered nurses and other professions, reinforces public trust and ensures APRNs remain highly prepared to meet those complex healthcare needs. Together, these strategies advance healthcare delivery while maintaining patient safety and ethical integrity. In conclusion, this literature supports expanding APRN scope of practice. Ethical considerations and workforce data suggest that modernizing scope laws improves access, especially in rural areas and rural states like Kentucky. I look forward to discussing how these regulatory changes may shape the future of advanced nursing practice.